easiest place to start is readmissions. And I think readmissions everyone's aware of in terms of the impact, and everyone's excited about it because there's a penalty associated with it. To me, though, it's really more a model of how we learn how to do transitions of care and thinking about, patients don't really exist within an acute care building and then within a clinic. They really just live, and they interact with the healthcare system at various points. And we need to learn how to manage that better, because we haven't done a very good job of that. And so we think about readmissions as a model for transitions of care and care across the continuum. It happens to be one that a lot of people are paying attention to, and as are we. So, as we did readmissions program, the first year was heavily focused on turning the mirror inside and saying, what are we doing in the acute care hospital that we can do better to prepare the patient to go? And those are fundamentally important steps, but very quickly you learn that, it's when they leave that they're at risk. And we can do some stuff to prepare them, but out in the real world, there's a lot of complexity to it. So we've been thinking in multiple different ways, how do we continue the care that we started in the acute care hospital out into the community? And so, one of the first things we did towards the second half of the first year was start to think about home care as a key partner. Just a home care referral isn't the same thing as figuring out which home care agencies practice a lot more like we practice and have good, close relationships. And so, I think that's why HRS is one of those partners that we think about now. It's not an official partnership or anything, but it's certainly one that means a lot. The idea for EMS, honestly, I have to tell you, that was your coming to us. We had not thought about that. I don't think that was in any of our heads to imagine this as even a possibility. But as soon as, I think it was probably 20 minutes into the first meeting, and I think all of us were saying, wow, I'm not sure where we're going to go with this, but this is an incredible path that we hadn't thought about. I think what you described is a couple of key pieces that are really intriguing about this is we don't know what the home looks like. When we're in the acute care hospital, we don't really know what that looks like. We send people out, and here's an opportunity to very quickly have an eye on the home, which we've never had before. The home care nurses do, but they're not there right away. And this is sort of that bridge there. And then the second piece, which is sort of that to be coming in the hopefully near future, is this idea of home care really partnering with EMS in a way that I think is, that's very exciting, because home care sort of out in the community, I can think about as home care as sort of the chronic disease management piece, but we still need the ability to respond quickly to things that, chronic diseases, when they go bad, they can go bad quickly. And it's almost like a partnership with the primary care provider and the hospitalist, which is what I am, or the ER. And so conceptually, it's just such a fantastic idea.